Welcome. We are the Florida Plastic Surgery Group. We're a preeminent breast reconstruction practice in the state of Florida.
We're located in Jacksonville, Florida, and have multiple offices in the greater Jacksonville area.
Our team of doctors and physician assistants combined has decades of experience treating breast cancer patients.
Whether you're newly diagnosed or have been previously treated for breast cancer, our team will help guide you through the latest techniques in breast cancer reconstruction.
Since our inception, it has been our privilege to treat thousands of patients throughout the Southeast. Whether you have just been diagnosed with breast cancer or were treated in the past for breast cancer, you have the right to receive breast reconstruction for both the affected and the non-affected breast, pursuant with the Women's Health and Cancer Rights Act of 1998. We are part of a multidisciplinary team approach with other specialists involved in your care to help you choose the path that is right for you. You may opt for reconstruction or not. Our goal is to ensure that you are informed to make the proper decision for you. Once you have decided breast reconstruction, we will work with you and your cancer team to determine what is the best timing based on other therapies you may require, such as chemotherapy or radiation. Immediate, delayed, or combined in what we refer to as delayed immediate. Now, we will walk you through your reconstructive options, whether you choose mastectomy, one or both breasts, or lumpectomy, otherwise known as breast conservation therapy, should you need any technique to improve the symmetry of your breasts following treatment.
Now that Dr. Parks has introduced whether the timing of reconstruction or whether it's immediate or delayed, I want to begin by teaching you further on how we can reconstruct a breast. In general, I tell patients there's two broad categories for breast reconstruction: implant-based or non-implant-based. Implant-based is exactly that. We use an implant to reconstruct the breast, and sometimes that can come in the form of an expander or sometimes direct-to-implant, which we'll get into further. Non-implant-based reconstruction, also known as autologous reconstruction, is where a patient uses their own tissue to reconstruct the breast. The advantage of an implant are there's no scar anywhere else, there's a shorter recovery and a shorter hospitalization. The disadvantage of the implant are there is maintenance associated with the implants. They don't last forever, and there is a series of processes involved through the expander reconstruction. The advantages of your own tissue are it's your own tissue. It'll last you for the rest of your life. It'll age with you. It'll change with you. The disadvantages are it is a little longer recovery and a little longer hospitalization, and there is a scar, donor site, a scar somewhere else in your body. But sometimes it's not that bad because we can get to remove some unwanted fat from the abdomen, and most people don't think that as a significant disadvantage. They actually think of it as an advantage. Implant-based reconstruction can be done a multitude of ways. The most common technique is expander to implant reconstruction. An expander is a glorified water balloon in which we basically put either above or below the muscle and use it to stretch the skin just like a baby grows in mama's belly. This creates the shape and platform for the ultimate breast reconstruction. We recreate the folds of the breast, the volume, and in many instances are able to preserve the nipple areolar complex. The expander is filled in the office as you come back, and we can inject saline into the port, and it can be done weekly, or it could even be done less frequently than that, depending on the patient's comfort and their personal schedules. Once patients get to a size that they feel comfortable with, we work with them on trying to establish what that may be for them in their frame. We then do a second stage operation in which they have an outpatient procedure where we remove the expander and replace it with an implant. Another option besides expander to implant reconstruction is called direct-to-implant reconstruction. Most of the time this is reserved for ideal candidates or special patients in which they have an ideal volume of breast. Direct-to-implant reconstruction is not great for patients that have very small volume breast or very large volume breast. And we try to meet the characteristics of the skin envelope to what we are trying to create when we're talking about reconstruction. Although direct-to-implant reconstruction is an option, it may not be the best option for every patient. What is direct-to-implant reconstruction? That is where we put an implant in as opposed to using an expander right at the time of the mastectomy. and this can create the volume and shape of the breast desired for that particular patient. Oftentimes, the vast majority of those patients will need a second procedure, oftentimes to inject fat into the skin to help create more soft tissue coverage so that we see the implant less and have a better overall appearance. As we've mentioned that many patients come back for a second stage operation, that second surgery is generally at least about 3 months after the first surgery or after any other adjuvant therapy is needed, like chemo or radiation therapy. During that second stage procedure, when we remove the expander, we'll replace it with an implant. And that implant can be either saline or silicone gel. Saline is a little firmer, it's a little rounder. If it ruptures, you'll know it goes flat and it has a few more ripples or folds associated with it. Silicone is definitely more natural, softer, has more or less ripples and folds. And if it ruptures, although you may not know it, it's memory gel, so it sticks to itself. It won't leak into your bloodstream. For the vast majority of our breast cancer patients, silicone breast implants generally provide a much more natural feeling and looking breast. When we see patients and they're wishing to undergo expander or direct-to-implant reconstruction, we generally talk about recovery in the term of lifting, restrictions, etc. Most patients, we tell them no heavy lifting or exercise for 4 weeks. In the first few weeks, they may have like a clear sticker or what's called tegaderm over their incision, but ultimately we generally move them to a sports bra and we want them wearing that for that second half of that first month. Patients will generally have drains, and those drains will typically stay in about 10 to 14 days. The incisions will have dissolvable sutures that are under the skin, and patients can generally shower when they're discharged home. In general, recovery time is estimated to be 4 to 6 weeks, and it can be shorter or longer just depending on each individual patient. For those patients that are having a mastectomy on only one side, we'll often and almost always perform a procedure on the other breast for symmetry. And that could be a breast reduction, it could be a breast lift, it could be an augmentation or an augmentation and a lift. And those symmetry procedures are covered under a patient's insurance policy. And we generally provide that so that we can provide a symmetric, balanced result.